All right, thank you so much, ladies and gentlemen, for choosing Imani Television and also for watching. It is another time for health, hygiene, and wellness. Welcome to this episode. My name is Barasa Saenyi, and today in our program, I'm privileged to have a guest. This is the first time I'm hosting her, so it's much of a privilege to me, and also the way she has dedicated her time to come and speak about the topic that you're going to speak about this morning. So stay tuned. After this program, I know you'll be educated and also informed much about the human papilloma virus, or HPV, as well as what is associated with HPV and vaccination, as well as cervical cancer, a little bit about cervical cancer. So stay tuned to the program. I will let her introduce herself, then we'll be taking over from that. So welcome, Daktari.
Thank you so much. My name is Dr. Sheilah Ilung'a. Yes. I am the sub-county MOH in Kiminini, and I am a medical officer. Yes.
Welcome to our show.
Thank you.
And I'm very grateful and I appreciate your time this morning.
Thank you. Yes.
Now, if we can just begin from here, what is HPV, or human papilloma virus?
Human papilloma virus, as HPV, is a virus and is one of the causes of cancer, and we have different types of cancer, but normally it affects the cervical cancer. Yes.
Now, when we talk about HPV, maybe are there any different types of HPV, or is just one type, the virus?
Okay, the virus has different types. We have type 16, 11, 13, and others, but we are just focusing on the types that cause cancer. So there is 11, 31, 35. So there are so many. There are so many. Yes.
These other ones, do they cause any other disease, or it is just that they exist?
The type now 16 and 11, it causes the warts. It is very notorious for warts. The others is just there, but it causes some level of genital warts. Yes.
And maybe about the vaccine, Daktari, the vaccine handles all these types, or is just one that causes cancer?
Now, the vaccine does not handle all this. Vaccine against 16 and 18 cancer. Yes, now the one we're trying to just to spread the word around, because us as the medical fraternity, we cannot do it alone. But if we have people like you, the media,
yes,
the ujumbe inafika haraka. So we need the whole community to come together so that we vaccinate our children against HPV.
Do you think we should make it mandatory for maybe primary school children to have this vaccine? Because maybe it's something that puts them at risk.
I believe it should be, but again, it is a behavioral issue.
And cultural as well.
And cultural as well. Yeah, so we might say everyone should have the HPV vaccine, but you know, we have also rights. You might decide, I do not want. I don't see the importance of it.
All right.
Yes. And we are advocating for young children, the adolescents, to get the HPV vaccination, so that in order for them to, prevent cancer in the future. Yes.
Which type of HPV causes cervical cancer?
We have the type 16, the 11, the ones that I have mentioned. Those ones causes cancer, and also they also cause warts. Yeah, so also they're in that group of also warts, genital warts.
Warts like lesions or?
Lesions, yes, skin lesions, yes. So when you get a wart, probably in your genitalia, is a HPV that has caused it. Also on the skin is a HPV that has caused it. So yes.
Which gender does HPV affect? Does the boy child also are affected with HPV?
Yes, also the men are affected, the gender boys, girls, but mainly it affects because of cancer. Now the risks, the female get probably the highest of effects of the HPV. And I just mentioned the HPV that causes cancer. Yeah. You get that most of the women actually get cervical cancer in the ages of 40, 30, and now that is a huge burden to Kenya in health. Yes. So we are now advocating for those who have not started any sexual activity, we get HPV so that we prevent cancer in the future. Yes.
And why do you target the little girls, or maybe let me say underage girls?
We are targeting the underage girls because number one, they are innocent. That's what I believe. And number two, they haven't started engaging in any premarital or any sexual activity. And the time that we are in, you will find out that most of the children or most of the teens are engaging in a lot of sexual activity, things that we didn't even know about. So even as we mentioned about cancer, we are thinking of, there's also the throat cancers, there's also the anal cancers.
Yes.
So this is all sexual, because now our children know what is oral sex, what is anal sex, and the main sex that we normally have. So we are trying to give them the vaccination so that in the future, at least it prevents that burden of cancer. You can imagine you have been probably a virgin all your life, and then you find yourself at 40, at 50. You have probably gotten married, and probably your other partner cheats on you or is unfaithful. Now what happens is at the age of 50, you are diagnosed with even stage 4 cancer. That is very heartbreaking. So we are trying to say that all, actually under 9 in Kenya, should get HPV, including the men, because men are more carriers. Yeah, and that virus hides in the cervix, so it takes time to change the cells of the cervix. That's why you reach age 40 and you're told that you have cancer. Yes.
Now, as we target the underage girls that below age 9, do we assume that they are born with this virus, or it's just a prevention measure?
It's a prevention measure. No one is born with the virus. In fact, if you are very healthy, the virus clears itself. Yes, the virus actually can clear itself in case you are infected. But what we're trying to say in the age and time that people are very busy, you don't know what your child is doing. So it's a preventive measure so that when you reach that age, at least we have prevented some 90 degrees that you will not have cancer. Yes.
All right. And how does one contract HPV?
HPV is a sexual STI, if I may say. And you contract it by having sexual intercourse, and it's not among those that we really know, or that when you say that it will show. No. It will take time for it to show. So if you have warts, so probably you already have a HPV issue going on. So those cases right now, that's a sexual transmitted infection. But as I said, if you're very healthy, your body will be able to clear it out. Just the same way flu. Yeah.
The body immunity itself.
Yeah, we're talking about immunity. But if your immunity is very low, then yeah, you just take precautions.
What is the risk factor for HPV? Or can we say what causes HPV normally?
Just like saying what causes flu. It's just a virus. Yeah. HPV itself is a virus. It's a virus that causes cancer. So we are advocating for people to be vaccinated. That's the same way that we said COVID is caused by a virus, right? Yes. So the COVID virus, that's why we advocated for people to get the vaccine.
Yes.
Yes. So HPV on its own is a virus, human papilloma virus. So that one is the one that causes the cancer. So we are asking people to go and be vaccinated against, yes, the virus. Yeah.
Now, Dr. you said that HPV affects both genders, the male and the female. But looking at the vaccine and how it's given out, they are targeting the girl child more than the boy child.
Yes.
Why is it so?
They're targeting the girl child because, number one, you will see the burden of cervical cancer. The boy child or the other cancers, you really won't really see it as much. But you see, the virus itself hides in the cervical area, the cells. So they are targeting the girls. And number two, we are also thinking about the availability of the vaccines. Because it's also an expensive venture, we don't really have a lot of vaccines. So we are targeting first the girl child to be able to be vaccinated, but in other countries, also the boy child is vaccinated against it, because boy child is a carrier. You understand?
Yes.
And even as you see the population ratio, you'll see that girl child are a lot. Yes. So you'll see even a man will marry 7 women. You understand? So that's why we are targeting the women. Yes.
Now, a woman has grown up maybe carrying the virus, and she's given birth to a child.
Yes.
Can it be transmitted from mother to child
No.
during childbirth?
No.
Why not?
No, it is not.
Uh-huh.
It is not transmitted. What I'm trying to say is the child will not have human papilloma virus. Okay? What we are trying to say, it is a sexual thing, just like gonorrhea or syphilis, that you can take medication. And even you won't know that you are a carrier until the symptoms start. You
What
understand?
are the symptoms?
Now the symptoms are now what I had mentioned. Probably at age 49, that's when you see that, I'm bleeding a lot, I'm losing weight a lot, and then when you go to the clinic and they do a pap smear or they check you, they are telling you probably you have a cancer, you might have cancer. So it is not something that you will see immediately like the other STIs. It takes a very long time for it. So even as you give birth, you might not really know that you have HPV. But I've seen women who have warts, and now you will actually tell them that this is caused by HPV. Now that is a sign and a symptom that probably one of you was not unfaithful, or it has been in your body for a long time. Now it's showing the signs and the symptoms. Yes.
Is there any way one can handle HPV while it's still on the early stages of the warts and the lesions?
Now on the warts and the lesions, you can actually go to the hospital, they freeze them, they cut them, but now you have to also boost your immune. Yeah, you eat things that will also boost your immune system, more vegetables, and after, as we say, if is any STI, even if they clear the warts, you have to also to change your patterns. Probably you are the one who is unfaithful, so you just stick to one person. Yes, if you are married, you also tell your partner that this is what I'm going through. You avoid any sexual intercourse at that particular time while you're getting treatment. Yes.
And maybe, apart from cervical cancer, what are other health complications that arise from having HPV?
Apart from cervical cancer, you can get the throat cancer, as I mentioned, because people are also engaging in oral sex. And I think people don't understand that the HPV normally hides in the men organ system as well as the women organ system. So you won't really say that that person has the HPV. And then number two, we also have the anal cancers. So probably most times it's the cancers and the warts that it causes. But if your immune is very well, you won't even know that it's there.
At which age bracket is mostly affected by HPV?
As long as you start sexual intercourse, you are at risk. Yes. Even if you are 10, you are at risk.
All right.
So that's why we are advocating you either abstain or you get the vaccination. And we are advocating get the vaccination so that when you start engaging, at least you have protected yourself 90%.
All right.
Yes.
If we can just turn a little bit to the vaccine.
Yes.
What is the uptake right now? How is the uptake right now for HPV vaccine?
Okay, now in Trans Nzoia, we were almost like 40% uptake. That is now last year. When we had the stakeholders meeting, we saw that the uptake has gone down. I don't know if it's about the culture or the myths about the vaccine, but I believe that people are not privy to the importance of our children getting the vaccine. But if they do know, they will come. So we are advocating that school-going children to be given the vaccine, especially primary schools. And yeah, when it's that way, then the uptake will go high. So there are 2 doses, so at 0 and after 6 months. Yeah. So that's one when they had the pilot, a lot of people were getting, but now people have relaxed. Yeah, getting the vaccine.
Why can we say they are resistant right now, or they are relaxed?
I think it's just an issue of information that when you go to a health facility, the HPV vaccination is there. Yeah, in all facilities. So if you go to even a dispensary, you get the HPV vaccination.
Is it costly?
It is free. Yeah,
just like for just for treatment for TB.
Yeah, just like for treatment for TB. Yes, it is free.
What does the vaccine maybe what is it composed of?
It is a live virus. And it's just an injection. Okay, the method of injecting that, it is through your body. And I won't say what is composed, but it is live. Yes, so that your body can actually build the artificial protection.
We can say it's like the antigen
for the virus. So your body is supposed to bring the white body or white cells,
yes,
so that it defends when now you have the HPV coming. Your body is already synthesized that this one, will deal with it. It's just like the COVID, that we have the antigen that is live and that is captured, but this one is a live virus. Yes.
How many times should one get this vaccine for HPV?
Twice. When you start,
twice in your lifetime?
Twice, no, is for full protection, we say twice. But even if you get the first dose, you need another dose. Yeah.
And who are the ones that should receive these vaccines?
As I said, both of them should receive. It's just the availability of the vaccine. But right now we are targeting the females. And the young girls at age 9. Yes.
Now, pregnant mothers, can they also receive the vaccine?
I think when I said HPV already, if you're pregnant, you're already exposed. Yes.
All right. Yeah. Now, about the vaccine, maybe, the girls,
yes,
at that age, do you think that they have been given enough information to understand about the vaccine and maybe about the virus itself?
I think mostly it's to educate our parents, because we are the custodian of our children. I can educate a girl and say, you need this vaccine, and she'll agree. But also we need a consent from the parent. So let's educate our parents on the importance of bringing the children to hospital to get the vaccine. Just like polio. Polio, if you don't vaccine your child, you also get a disability that you will not want. So that's why we are educating that all parents should be able to understand that we need to vaccinate our children against HPV, so that in the future you don't have that high risk of contracting cancer. Yeah.
You said that maybe they receive these doses at 0 months and also after 6 months.
Not at 0 months, as 9. Okay, you are 9 years. So when you go and you receive.
That is the first time?
That's the first time, and then there's a second time, either at 6 or after 1 year. You'll receive the second dose.
Why is it recommended so?
It's recommended so that it just builds. When you give one dose, we are trying to say we have introduced a virus in your body, okay? So that it builds that defense mechanism. Now, if you take another one, a booster, it's just like boosting your immune. Yeah, that's what we are trying to say, that just finish the 2 doses. Yeah, it's not as if it will harm you or anything.
Are there any side effects after taking the vaccine?
Well, different bodies react differently. Some will have the pain, and some will have itchiness, just the normal regular side effects for some people. Some will have fever because you're introducing something in the body, but it doesn't have a long-term effect. But if you have a long-term effect from the vaccine, probably you're allergic to something, you come to the hospital and we manage you there. Yes.
Doc, maybe there's a parent right now watching us, and she's asking herself, what is the importance of my girl or my child taking this vaccine? What can you tell her?
I can tell her that at this age and time, as parents, number one, we don't know what our children are doing. And especially if you have a 10-year-old in the house, it's better that protection is better than cure, or prevention is better than cure. Protect your child from HPV. Number two, incidents of defilement and rape also are increasing. So you don't know what your child goes to school and someone does ABCD to them. We are just preventing in the long term that you will not have the costs or the burden of treating cancer. As you know, that cancer is a very painful, and it takes a lot of money for someone to treat cancer.
Yes.
So that is what I'm trying to say, that protect your children, prevent them against HPV. Yes.
Now, maybe if I can take you back a little bit. It is HPV, we are treating HPV to prevent cervical cancer.
Yes.
How does it come? How long does it take for the virus to develop into full cervical cancer? As
I said, it takes years. For example, if I'm sexually active at 20, probably the first man that I will sleep with might not have the HPV. So we break up. You go to the second person. The second person probably has HPV. It will take a long time for it to manifest. As I said, there are different types. So it will a long time for it to manifest. So you see, as you keep on engaging with different people, as is an STI, it means that the person who will give you the HPV might be very healthy, and this person might be a carrier. So when it goes now to the cervical cancer, it takes time to change the cells. Now, as it changed the cells to a full-blown cancer, you won't know, and it will be too late. And that's why we are also advocating at age 25, start your pap smear, especially if you are sexually active. Pap smear, go to your gynecologist to check you each and every, after even a year. Okay? You do it yearly so that you see, are my cells changing? And if they are changing, what now happens? Can we now do some intervention before it is now from stage 1 to stage 4? So we are also advocating that pap smear, your regular checkups as women, it is very important. Yes.
So it means at what age is one excluded from this the vaccine? Can a 26-year-old get the vaccine?
Yes, the 26-year can get a vaccine. If you are not sexually active, you can get the vaccine. I don't want to put it to say if you are a virgin, yes, but if you know that you have kept yourself, you can actually get the vaccine. Yes, because HPV is sexual. So if I already had sex and that person has already infected me with HPV, you just pray that your body is strong enough, or your immunity is strong enough to deal with it.
Maybe someone has just had sex. Are they at the position of getting the virus, the vaccine, I mean? You've already broke your virginity. You've already engaged yourself in sex. Can you get the vaccine?
As I say, this is already exposed yourself. Yeah, and the only thing that I can say is you just do a checkup. There are tests that actually can check if you have been infected by HPV. If not, then you can get the vaccine. Yes.
What about fully mature women? Now, maybe they've been going for screening for cervical cancer. Can they still go for?
No, you just continue for the screening. Yeah.
So you forget about the vaccine.
Just forget about that one. Yes.
Is it safe?
For
the vaccine?
The HPV. Vaccine is safe. The vaccine is safe. Yes.
All right.
Yeah.
I'm looking for other questions here.
Yes.
For the warts, maybe we can go back to the warts.
Yes.
How are they treated?
Number one, if it's just a lesion, just like one wart, they actually can freeze it, or we have some medication that actually, I don't want to say ban, but can corrode the wart. Okay. And then if it's a fully blown wart, there are procedures that can be done in the hospital. It can be cut, and then after that you have time for recovery. Yes. So there is the freezing method and the cutting method, but it is not a guarantee that it will heal. It might come back. It can recur. Yes.
All right. Now, and when you have a HPV, how does it develop into cervical cancer? Maybe that's where someone wants to get it more clear.
As when you have sex, when you have sex, the person that you're sleeping with, you're not sure if this person is a carrier, especially the man, if he's a carrier. So you'll have sex and you continue having the sex. Now, the virus now hides on that cervix, okay?
Yes.
And then it changes the cell. What is cancer? Cancer is the abnormal growing of a cell.
Yes.
Right? So when now that cell changes, now it goes from stage to stage. At stage 0, you are likely to have a different change of that cell. But if you go to hospital, they are able to do a procedure to test if this is cancerous or not. If they find it's cancerous, now they'll tell you, we are going to do A, B, and C. But if you take a long time and it changes, the abnormal changing of that cell in the cervix, it takes a very long time. A very long time. That's why we are advocating for pap smear. What is pap smear? They are taking a sample to see if your cells are normal. or if they have changed, or if there is a virus. That's now the HPV virus. Now, as you move along, you'll be told, okay, you are at risk, you're not at risk, or you have cancer or you don't have cancer. Yeah, so it takes a long process. So as you see, most people, when they get cancer at what age? 40, 50. Yes.
All right. Now, how can someone prevent him or herself from HPV?
Abstain.
Abstinence.
Abstinence.
That's the only way to prevent yourself.
Abstain. And when you're ready to get into marriage, just have one partner. Yes, and protect yourself probably by using a condom if you're not sure this is the partner. But I will always advocate by abstaining. Yes, but if you're into it, well, just protect yourself by condomizing. Yes.
Doc, and what may happen if someone just ignores the vaccine and also keeps herself or himself just clean till the right time?
That's what I'm saying. If that's way, I said it's an STI. So if you keep yourself well and good.
Is there any way that you can get HPV without engaging in sex?
No.
All right.
No, unless you're doing oral sex. But that is still sex.
And how common is it? How common is HPV?
HPV is very common. It's that it's a silent killer. Because each and every day, everyone is having sex. Yeah. So you're exposing yourself. Yes.
Is there any way a parent can notice that my child maybe is having HPV without any health analysis or any other doctor analysis?
I think your question is, how can I know if my child is having sex? I don't think there's a way. I think we just have to be very vigilant with our children, and when behavior starts to change, you start asking questions. And I believe in sexual education. When you tell your child, do this and do this, then it's upon you as a parent to watch. I know we are busy making ends meet, but let's take care of our children. Just the same way you not know your daughter is pregnant until they are expelled from school, or a test is taken in school and they are telling, hey, mama, come and see, your child is pregnant. You won't know. Yeah, one of our baggy things, so you really won't know.
It's true.
Yeah.
Now, let's talk about some of the myths and misconceptions maybe that are associated with HPV.
Yes.
Does it cause infertility?
The vaccine or HPV itself?
Both. Maybe we talk about HPV first, then the vaccine.
As I said, HPV is a virus, so it does not cause any infertility. Just the same way as you get a sexual transmitted disease, like what do you call it? Yeast infection and all those things. So those ones do not cause. You'll see a mother who is pregnant and having probably warts. So it does not cause any infertility. It means that already it is there. The immune was unable to clear the virus, and the mother is pregnant, so it does not cause any fertility. Also, the vaccine does not cause any infertility. Yes, you are just taking it to prevent, just like the same way polio, all these ones that you are getting. You know, even the means of COVID, people are saying a lot of things, but it doesn't.
Some parents say that maybe I don't want my child to get this HPV vaccine because it is like I'm giving her permission to have sex.
Oh yeah. Yeah.
How can they go about with this? How can they tell their children now it is HPV, you're just going for a vaccine, and it's not permission to have sex?
It is not permission to have sex. As also me, I'm not also for the idea of just giving because now you want to be immoral. No. Even if you get the vaccine, there is a high chance, the 10% that we haven't sought out, you might get the cancer. We are just trying to help you not to get cancer later in the future. So you have to explain it well. It's not a license for you to have sex, but you are preventing consequences later in the future.
Yes.
So that you don't have cancer. Yes.
Is there any possibility that the vaccine may not work and the girl child may be at risk of getting the virus again?
Of course, yes. It's not that the vaccine is like not 100% proof. How many of us have been vaccinated from COVID but you still get COVID.
Yes.
But it does not mean, but the consequences or the effects of that COVID will not be as bad. Now, we're trying to say that as you get the vaccine, we are not saying that you won't get cancer. You might get cancer, yes, but we are just preventing you to a certain percentage, 90%, so that also it reduces that burden of going to fully blown cancers in Kenya, because really cancer has gone up. Yes. Yeah. And this is just about behavioral change. If we can all decide we are going to abstain until the right person comes or until the right time, then so be it.
And actually, how many doses are there for the virus vaccine? How many doses are there
currently? I will not know, but they are enough.
And for the girl child, how many should she take?
As I said, 2. Yeah, there's the first and the second. Yes.
After that is the first month and after 6 months. Now, I thought there were 3.
Well, the issue is, of course there will be 3, but now the availability of it. And also you'll find that people don't also come for these doses. So we are trying to say, at least get 1 dose. After that 1 dose, come for the second one. If you are able, finish the last one. So me, I would advocate even 2 of those doses will really do a great job for us, yes.
And is there any way someone can screen for HPV?
Yeah, there are institutions that do those screenings for viruses. You just go, they screen if you have HPV. Yeah. And
maybe other misconceptions and myths that you have heard about HPV?
I think it's just that it causes infertility. Someone who might not be able to have children, but that is just a myth.
All right.
Yes.
And going to the hospital.
Yes.
Is it costly? Can my insurance cover HPV vaccine?
Are you going to a private or a government one? If you're going to the government, it is free. It is free, just the same way as you bring your child to be vaccinated or at the under 5 vaccinations. Also HPV is free. That one is free. But in other institutions, probably you will go. The testing, I know you'll have to pay the testing for HPV. And some of them, they might charge you, but it is free as per now. Yes.
All right. Yeah. Now, Doctor, what will happen when I break the chain for the dose uptake? Maybe I took the first month and I didn't come for the 6-month one. I lost it. I just went away. What
now, as long as you have a card, okay, that showed that you took the first dose, right? They'll give you the second one and then the third one. You'll be told now to be consistent on coming. Yes, just like what do you call it, hepatitis. If you took the first dose and you lost it, they will come back and then you said, you know, I had the hepatitis vaccination card, but I didn't take the second one. So they will actually advise you to take the second one and also continue. Yes, but just keep those dates that they tell you to come back.
Does it come with effects on my body or something?
No, it doesn't. It doesn't.
All right. Yeah. Anything you can add us more about HPV, Daktari?
I think, as I said, HPV is a sexually transmitted virus, just like any other viruses that are sexually transmitted. People should just understand it is a virus that causes cancer. It is not cancer itself. Yeah, because cancer is caused by that virus. And the particular type of cancers that we are focusing on is the cervical cancer, the anal cancer, and the throat cancer. So as parents, as young people, let's just be known that there are those risks. Don't expose yourself so much to many sexual partners and keep yourself.
All right. Now, thank you so much, Daktari,
yes,
for sparing some time to talk about HPV with us.
Maybe
your last remarks about HPV?
My last remarks will be, as you go to the facilities, just tell everyone that you're coming probably for the vaccination and you'll be sorted out. The nurses will sort you out, the doctors will sort you out, and you're welcome, yes, to our government facilities.
All right.
Yes.
Thank you so much, Daktari. I
Thank
hope you will find some other time also
Yes.
to come and speak about another disease maybe.
Yes.
And God will bless you.
Thank you so much.
All right.
Thank you.
This has been Health, Hygiene and Wellness. My name is Barasa Saenyi. Thank you so much for watching.